This video is all about BPPV, Benign Paroxysmal Positional Vertigo. I understand what you're going through. When you have an episode of BPPV, it is frightening. You have other symptoms, unbalanced, nauseous, but you're downright scared. I understand this for two reasons. I've seen hundreds of patients with BPPV over the years. As well, I've experienced it myself. One morning I woke up from bed, walked into my washroom, and literally fell against the wall. People that have never had BPPV will never understand what you're going through. Not only is it scary when you have an episode of vertigo, your quality of life is poor. You cannot go out, you cannot work. It's very difficult to move and it affects everything. In this video, I'm going to answer the most common questions I get about BPPV, not only in my clinic, but also on YouTube to help you navigate your recovery. And let me tell you, you will get better from this. What causes BPPV? Well, there's a variety of things, but let's understand what it is in the first place. BPPV is when the crystals leave the utricle in your inner ear and they enter the semicircular canal. The problem is that these crystals are not designed to be there, or they're not meant to be there. What happens, it stimulates the receptors within those canals and gives altered information to your brain, causing that extreme bout of vertigo. There are many reasons why this can happen. Oftentimes we'll see someone that has had trauma, a concussion, or whiplash. That seems to dislodge some of these crystals, allowing them to travel where they're not supposed to be. Other times we see it following a vestibular infection in the inner ear that seems to precipitate those bouts of vertigo as well. Other main causes are just the aging process itself, but there is always the idiopathic cause as well, the unknown reason. There are a variety of reasons why you might have this, but the good news is it can be resolved. Another question I often get is, are there different types of BPPV? And the truth is, there absolutely is. The most common type of BPPV, though, is the posterior canal. The second most common would be the lateral or horizontal canal. And finally, one of the most rare types is when the BPPV involves the anterior canal. There's various testing and symptom pictures that can indicate which one you might be suffering from. Another question I often get on some of my YouTube channels is, can you have BPPV in both ears? The answer is yes, but it's not as common. Often about 10 to 15% of patients will experience BPPV in both ears. The next logical question comes is, what should you do if you have it on both sides? Well, you need to test which side is worse. Oftentimes that will be indicated by if you roll to one side or the other and it's worse on one side, then that should be the side that you start with the appropriate maneuver first. Then, once you've solved that side, you'll move on to the secondary side that initially was not as bad as the first. Can BPPV come back after it's successfully treated? Unfortunately, it can. In fact, it can come back in 30 to 50% of cases within the first year after successful treatment. But don't let this frustrate you. If you've solved it once, you'll absolutely be able to solve it again. There are risk factors that might put you at more risk for it to return. Things like age, underlying medical condition, especially vestibular conditions like Meniere's disease or a recent ear infection. The good news is you can help prevent future attacks by performing vestibular exercises, neck range of motion exercises, posture exercises seem to help. So there are proactive things you can do to help prevent future episodes. Another question I often get from patients that are concerned about their BPPV is, can this condition cause permanent dizziness? Well, the answer is, if you treat it effectively, no. However, if it's left untreated or it's been misdiagnosed, then you can be left with a chronic imbalanced state. The good news is that can be corrected as well. What happens in some patients where their dizziness or their vertigo has been misdiagnosed, either the wrong condition or the wrong canal, the brain can maladapt and create a chronic state of imbalance. The good news is, with vestibular therapy or vestibular ocular therapy, you can still resolve this condition. Another thing to know is those patients that suffer chronic or recurring bouts of vertigo often may develop an anxiety disorder that can create a situation where you are chronically dizzy or your dizziness or vertigo is easily irritated. If this is your case, please speak to your health provider so they can provide some options for you to get better faster. How long can it take for an episode of BPPV to resolve? Well, this is different for every patient. Typically, if you have a posterior canal vertigo or BPPV, this can take between 1 and 2 weeks of successfully doing the epi maneuver. If you have a lateral canal BPPV, expect this can take up to 4 weeks, and this would be after doing successful completions of the maneuver, for example, like the barbecue roll. Oftentimes, in each of these cases, you need to do the maneuver multiple times a day, daily, until the condition improves or resolves. And bear in mind, even after successfully completing a maneuver, whether it be the epi or the barbecue roll, you still may experience some residual dizziness that will take, again, a few days to a few weeks to resolve completely. So be patient with the process. Also remember, if the condition goes untreated, it can last from weeks to months, and this puts you at risk for more falls and other conditions down the road, such as persistent postural perceptual dizziness, or PPPD. So don't delay in treatment. Make sure you're getting the right diagnosis and you're getting the appropriate help to help you resolve your BPPV as quick as possible. Since we see many patients suffer from cervicogenic dizziness, the type of dizziness that comes from a problem in your neck, a common question I often receive is, can BPPV be caused by a neck problem? The answer is not typically, and what I mean by that is there is some research that suggests, and I definitely see it clinically, that if you have a neck issue that causes you to have a restricted range of motion and neck pain, then oftentimes BPPV is difficult to treat by yourself, just by nature of the lack of range of motion when you're trying to do maneuvers to correct it. The other thing that we see in our clinical office is that when we treat a neck problem that is in association or even separate from BPPV, those patients tend to get better faster and have less recurrence. So I do think that there is a connection between the neck and BPPV, just not a direct link. Definitely, if you're suffering from BPPV and it's been coming back and going, it's being tough to resolve, please seek out the care of someone that specializes in neck conditions to help remove any problems in your neck that might be inhibiting your ability to heal from your vertigo. One of the most common questions that I'll get is, what can I do once I've done a successful maneuver and I've got my BPPV under control? Is there anything I can do to help mitigate or reduce the chance of a flare-up or coming back? The answer is yes. Once you've done a successful maneuver, then one of the best things you can do is make sure you're not excessively moving your head either up and down or to the side. You also want to make sure when you're lying down or sleeping, you might want to try to sleep elevated slightly for at least a day, like on a wedge pillow or something where you can control your head movements in the middle of the night to avoid a flare-up. The other thing you want to do is make sure you're well hydrated. That seems to help reduce the chance of a flare-up happening immediately following the successful resolution of your symptoms. One thing I often recommend for patients is to get back to an exercise routine or a movement routine as soon as possible and as soon as you feel comfortable on your feet. For some, that might be back in the gym on a treadmill or doing weights. I find that when you start to stand and you start to fire your postural muscles, you are having input from your proprioception, from your joints back to your brain. It just helps stabilize your balance and it helps you recover faster and more permanently. So get back to activity as soon as you can. One thing I need to say is, if you have persistent dizziness or specifically vertigo that has accompanied other symptoms, other neurological symptoms with facial numbness or difficulty speaking, get to the ER. This is likely a medical emergency. The other concerning symptom is if you have vertigo that never goes away. Do not ignore that symptom. Finally, if you have headaches or hearing loss, if you have difficulty walking without losing your balance, these are all reasons to seek medical attention immediately. On the other hand, if you've ruled out anything that's sinister and your dizziness or vertigo is intermittent, it comes and it goes, then this is time, if you've tried everything you can at home, to seek some help from someone that has experience dealing with dizziness or vertigo, so you can get the quickest amount of results in the shortest amount of time so you can get your life back, which is what we all want. I appreciate you tuning in today. If you like videos like this, please show some support by giving me a thumbs up. And if you're new to my channel, stick around and explore it. You might find something that's going to help you in the comfort of your home. And if you're really engaged, you might consider subscribing to our channel so you can be informed when I upload a new video. If you have a question or comment, please leave that below. I'll get to answering it as soon as possible. Thanks for tuning in. I can't wait to see my next video. Until then, stay well.